name is Mboya. I am presenting a study that was led by my colleague from the Africa Academy for Public Health, and it's particularly on the determinants of anxiety and depression. And this background has been repeated over and over and over again. So the study aimed to assess the prevalence of anxiety and depression and associated factors among adolescents 10 to 19 years of age in the countries that you see, but of importance we included India and China. And so the study was conducted by the ARISE network, and of course this was conducted before the rollout of the DASH and nutrients projects. And I think it's one of the studies that have informed the design and implementation of the studies being conducted within DASH and nutrients. And the data collection, I am mentioning only the key tools that have been used, and when we report the results, they should be clear to you. So PHQ-4 is a combination of 2 questions that measure depression and 2 questions that measure anxiety. And for depression, it is the first 2 questions of the PHQ-9 questionnaire, and for anxiety, it's the first 2 questions of GAD-7 questionnaire, and it has been proven to perform as much or as well as the long form of these tools. And for the subjective social status, you might have seen, if not, it's just a ladder that asks individuals to classify themselves of where they feel that they are positioned in that particular ladder. And then these questionnaires were standardized to collect similar information across sites. And in the analysis, we opted for a log linear regression model, which is basically the generalized linear model for those people who know statistics of Poisson family and the log link function to determine the factors associated with anxiety and depression. So the co-occurrence of these 2 conditions, the light blue bars, is still from a slightly different modification of the tool, but it's just measuring all the events, anxiety and depression occurring at the same time. And as you can see, the total or the prevalence of anxiety was 11% overall, and about 10% for anxiety. And you can see that the co-occurrence of both of the events is significantly larger. And one thing that I should mention here, compared to other countries, the adolescents in China were much younger. So they were like around 10 to 14 years of age, compared to the rest of the countries where they were somehow evenly distributed across the populations. And the factors that were associated with the anxiety and depressive symptoms and their co-occurrence, they were similar. Although in some analysis you might not find strong associations, but older adolescents, females, and those with perceived low subjective social status, and those who had visited a pharmacy or health facility for any particular reason, and those with history of substance use, particularly alcohol, and those who have ever engaged in any form of violence, or which means being seriously injured for more than 2 or more times in the past year, were more likely to experience these particular events. And one key key messages that we are getting out of this is that the anxiety and depressive symptoms are common, as my colleague has presented, and I am happy that in part of the results he indicated what adolescents feel consider as a mental illness or a mental health problem. So they are common in low and middle income countries, and particularly in sub-Saharan Africa, and both social demographic and behavioral characteristics, they do play a role in influencing these conditions. And our results provide essential evidence or essential data that are needed to fill the knowledge gap about these conditions. And again, as I said before, DASH and Nutrient, it is part of the project that has been informed by this and similar studies, and interventions to address mental health conditions are underway, being designed for implementation. So this work was funded by the Boltner Foundation through the Harvard School of Public Health, And I would also like to thank the co-authors of this of this work, because we have the manuscript already submitted for consideration, and probably your name can also be seen here. Thank you so much.